What is gestational diabetes? Complications of gestational diabetes. Gestational diabetes mellitus is defined as diabetes that occurs during pregnancy. Like other forms of diabetes mellitus, it is defined by the body's intolerance to blood sugar or the inability of the cells of the body to use the blood sugar, glucose. Gestational diabetes can occur in any pregnant woman and occurs in about 4% of pregnancies. While the cause for developing gestational diabetes is not known, it is an easily manageable condition. Complications of gestational diabetes. Gestational diabetes mellitus is defined as diabetes that occurs during pregnancy. Like other forms of diabetes mellitus, it is defined by the body's intolerance to blood sugar or the inability of the cells of the body to use the blood sugar, glucose. Gestational diabetes can occur in any pregnant woman and occurs in about 4% of pregnancies. While the cause for developing gestational diabetes is not known, it is an easily manageable condition. Gestational diabetes symptoms. In order to protect yourself and your baby, it is important to be aware of the gestational diabetes symptoms. The reason for this is because, more often than not, there are none. Most women who have gestational diabetes state that they experience no symptoms at all. Anecdotal reports of symptoms include an increased frequency of urination, increased thirst and being tired. Unfortunately, these are also all symptoms seen as a result of simply being pregnant. Gestational diabetes diagnosis. Doctors have understood that because of the fact that there are hardly any symptoms, there needs to be a better way for detection of gestational diabetes in pregnant women. The consensus was that all pregnant women should have a finger prick glucose during the course of their pregnancy. However, there are certain pregnant women should have their random blood glucose checked more frequently at set intervals throughout their pregnancy as a form of screening. Gestational diabetes risk factors. While there are no clear symptoms of gestational diabetes, there are risk factors which can be determined, which predispose certain women to being more likely to develop gestational diabetes during the course of their pregnancy. Women with these risk factors need to have their blood glucose levels checked more frequently. According to the WHO, risk of women was classified into two groups and determines who is screened. The risk factors are as follows. 1. Criteria needed. Number 1. Gestational diabetes in a previous pregnancy. Number 2. First-degree relative who developed gestational diabetes. Number 3. Having a body mass index, BMI, greater than 30 kg/m2, obese. Number 4. Current macrosomic baby. Number 5. Current polyhydramnios. Number 6. 2 previous episodes of sugar in the urine. Number 7. Being from a high-risk ethnic group, Hispanic, African, Asian. 2 criteria needed. Number 1. Previous big baby, greater than 4.5 kilograms. Number 2. Full-term stillbirth. Number 3. Previous birth with respiratory distress syndrome. Number 4. Age above 35 years, gestational diabetes management. Once diagnosed with gestational diabetes, it is important to maintain strict glucose control. This is achieved by managing a healthy, well-balanced diet, and with medication that is chosen is dependent on the severity of gestational diabetes and how well it is being maintained.